Let me just go over first what a diabetes educator, how they can help you. So the aim for us as diabetes education is to help our patients the best we can to receive the information, the knowledge, impart skills, and also give them confidence so that they can deal with the diabetes diagnosis. And it's a frustrating disease, and all of you already know what it is to have mitochondrial disease as well. So it is, like really, to me, it's like a double whammy in frustration sometimes in the management of these two conditions, especially when they are together. So as a diabetes educator, our roles really include explaining to our patients, so, what is diabetes, and in your case, how come, this condition, maybe brings on the diabetes. But really, the important thing, our cornerstone of our management with all my patients is really trying to get them to understand what the monitoring, how to monitor for the diabetes so that they can have, manage their daily routine. Also the food, discuss food and amounts of food and what to do with a lot of the food, and try to encourage physical activity. So these are like really the main things that we go through in the beginning with our patients. Now, diabetes, in diabetes, we have many medications. We've got oral tablets, we've got injections, and injections are not just insulin. We now have other injectables. So it's also, our function as diabetes educators is to explain the different actions of the medications. They all work differently, side effects of them, and also how to inject properly, how to to use the devices. And some of the devices are quite nice. They don't really look like, they're not like the old needles, but it's how to use them, how to safely inject the medication. So it's part of our work. Now, if you are on insulin, one of the important things that we also do is not only teach you how to use or to inject the insulin, but it's also how to manage that insulin so that you can, what we call insulin stabilization, so that we can find what are the best results, the best way of you injecting, how much insulin to inject every day at different times, so that you can have your diabetes well controlled. And that is something that your endocrinologist and your diabetes educators will look at your blood sugar. That's why looking at blood sugars is important for us, so that we can actually target that treatment, that stabilization, and to avoid low sugar reactions, because that's one of the worst, things that can happen, is that maybe you take too much insulin, or a medication that can cause low sugars, then you can have a low sugar reaction. So we need to teach and help manage low sugar reactions, and also when they go very high, what we call hyperglycemia. So if a low sugar reaction is, say, sugars below 4 or below. So if you're having many sugars that are, 2 or 3 sugars that are below 4 in a week, you need to contact your endocrinologist or your diabetes educator. Maybe you need some help with your management. With the high sugars, if your sugars are always above, say, 12, then you also need to discuss it with your even your GP in this case sometimes, so that we can adjust the treatment so that you don't run with very high sugars for a long time. Now, I think it's also important that some people read a lot of information and say, oh, my sugars need to be 5 or 6 or 7 or whatever, and they come with this expectation. Now, one of the things I always talk to my patients is, the expectations of what your sugars are depends on your condition. If you're elderly, if you've got something like mitochondrial, and it's an advanced condition, you are unwell, it's not those very tight numbers that we want. We want slightly higher numbers, as long as you're not having hypos, but you're still able to live accordingly. So depending on your situation, we may have higher or lower targets. Now, so if you are a type 2 that is like 18 years old, I'll be tough, you know. They say, no, can't do that. But if we need to aim to teach the best way to do it. So all I'm trying to say to you is, all of you are at different ages and stages of the condition. So the targets may change, go up or down, and that's very important. Please don't get focused just on one number because it's unrealistic and it can cause you more stress. It's also important to discuss sick day management. So you may get, say, gastro and your sugars plummeted, or you can get something like COVID where your sugars go really high. So it's how to manage those sugars. What plan do you have? Would you contact your GP, your endocrinologist, you know, your team that manages your diabetes? So you need to understand what to do and what are the first aid things that you need to do. So it's all part of our education around diabetes.
Diabetes is one of those chronic conditions that can affect all of the body. So we've got to be mindful, not just focusing on sugars, but thinking about what effect diabetes has on the heart, what effect it has on the kidney, what effect it has on your peripheral nerves and your eyes. So regularly having checkups with your optometrist, perhaps linking in with podiatry services, having a stress test if you're having chest pain. These sort of things are things that are very important and shouldn't be overlooked in management of diabetes in the longer term.
So with your GP, there are care plans that you can have, say for the podiatrist or for an exercise physiologist if need be. So it's something, the discussions that you need to have with your team. I don't actually know if the MILAS patients have had, I've never seen one on pump therapy, but pump therapy is a way of delivering insulin. But it is not a simple way of doing things. It's not a set and forget. So it's quite complicated and many decisions have to be made. So I don't know that it'll be something that your community, you know, will use often, but it is another way of that we manage diabetes these days, especially the type 1 patients and some type 2s have pumps. But it's something that, yeah, it's on a one-to-one. We actually have to have a meeting and sort of talk about all the pros and the cons of using such therapies. But it is part of our role, and it is something that we need to become quite accredited to manage. So in diabetes, we know, like in mitochondrial disease, that this stress, you know, we have the stress in diabetes. Our patients, some of them have had diabetes, you know, since they were children. We cannot ignore this issue, and it does impact on the self-management. So it is something that we address at every visit. But maybe
yeah. I mean, certainly, yeah, diabetes, distress, and depression are real things, and often, if we're in a poor mental state, our physical health suffers, and vice versa as well. So it's something that we should bring up at all our consultations, how people are traveling physically as well as mentally. So it's an important factor in everyone's ongoing management, particularly with any form of chronic disease.
And this takes us on that, you know, you need to have a general practitioner that you can relate to, that understands your condition and can organize for for referrals or for management of this for the condition, and optimize also treatment. And there are two practitioners. So we have GPs, we have endocrinologists, but we also have nurse practitioners. The nurse practitioner is actually one that can actually also have prescribing rights. So this might not be so important in the city, but if you have members that are in the country, maybe it's very hard to get an endocrinologist to see you, but maybe there are nurse practitioners in diabetes that may be able to help you to manage your condition. Of course, we are all involved in or we try to be in community education. I suppose that's what I'm doing today, both doing today. And health promotion is something that is quite, we quite enjoy doing. So it's part of our role as well. And also policy and procedures, especially at level of hospitals, and also we have colleagues that are involved in Diabetes Australia. So it's all that information. It's all part of our role, both as endocrinologists and diabetes educators. Do you have anything to add?
No. So, but I guess thinking back, I'm sure it's going to come up about the CGM issue. It is an ongoing issue for lots of people and lots of subgroups. And unfortunately, at the moment, yes, it is very much sort of the subsidization is very much focused towards type 1 diabetes. But with, I guess, advocacy moving forward, other subgroups are likely to become subsidized. But it's a matter of presenting evidence that this is a type of diabetes that really needs that technology. And I think that's something that we're going to need to work on moving forward.
So I'm not sure if you know, but these are the people that are who can be eligible to be a diabetes educator. Diabetes educators usually do a postgrad course, and so the main group are registered nurses and midwives that have done it. So we now also have the nurse practitioners because they've got prescribing rights. We've got quite a few diabetes nurse practitioners. But the other groups that now maybe are less, I'm not sure if you knew about it, there are dietitians, some doctors, GPs have become also educators, pharmacists, podiatrists, exercise physiologists, physiotherapists. And in the last week, the optometrists are also now allowed to do a postgrad course to become a diabetes educator. But I think what is important for this is the ones that can prescribe, especially I'm very mindful, I do work in country towns, and I know how difficult it is to access specialists. Your GP and your nurse practitioner are the people that can maybe help you with change treatment, try new things, and that's the ones that can prescribe. But the others, can really help you with the day-to-day management.